in 1997, my son developed juvenile diabetes. And at that time, I wasn't practicing internist. And the experience gave me a lot of insight as to what was missing in my own practice at that time. In 2002, went back into training, and I trained to be an endocrinologist because at that time, I realized that the treatment of diabetes was a lot more than giving medications or writing a prescription. When I first heard about Eversense, it was like, whoa, this is what we've been missing. This is what we were kind of waiting for. We have a very accurate measurement now that we can trust, and we have insertion of the sensor that is pain-free, hassle-free. We are at a point that the technology has evolved and has improved. So the glucose sensors, their accuracy, their MARD has improved significantly. Physically, they are a lot better. And I'm not sure a lot of our providers know that the team that is developing this was the same team who worked with the transcutaneous technology, and when they were the pioneers in that, and when they saw, okay, this is another technology which is a step forward, they took a big leap of faith because they knew the technology, they had the science patted down, if you would, and they have taken this thing, leaps and bounds, and now we have FDA approval. Today, you will see people who are using multiple transcutaneous sensors, and I hear the same thing as I heard 15 years ago, that we still have a cumbersome technology, we have these physical issues, the replacement issues, we have these accuracy concerns. So the evolution of the technology and the monitoring has really improved, has made a big difference in me taking care of all these patients at all age groups. The procedure is very simple. All you need to do is to anesthetize the skin with local lidocaine infiltration and have a very small incision. The insertion tool as well as the tunneling tool they're designed so well that after you've done a few, you will say, oh, this is not really a procedure, this is a mini procedure. Anything we do over time, the more we do it, the better we get. I remember my first insertion took a number of minutes. My last insertion under 2.5 minutes. And so it just naturally fit into what we do, what we believe in, and how it is going to benefit our patients. You don't have to be a big office. You don't have to be a center like the services that we can provide. You can be very small, one specialist practice with minimum amount of personnel. It can be done, and so the protocols are there, the training is there, and the team from Eversense, I cannot say more about that because they have been just absolutely phenomenal. So the Eversense technology is a natural fit. It is the best technology to date that we have out there for two big reasons, primarily. Number one is the ease of use. We insert one every 90 days. We have done a number of patients' second and a few of their third insertions, and they don't want to do anything else. If you look at the European data, over 85% of the patients came back for reinsertions for years and years. And so the second thing is the accuracy, that we have multiple technologies out there, but this is as accurate as any of them and even better. So if you look at the no hassle factor and the accuracy, it just makes sense. One of the roadblocks that were there were insurance coverage and the cost, and that has improved tremendously with all the work that the team has done over the last year. We get sensors in within 48 to 72 hours after orders shipped to the office, and so it is not a roadblock for us, at least, anymore. So the Eversense technology, what it is doing for us and for the patients, it just makes sense for us to use it.